Hi everyone, my name is John Jay and this is Health Talk with John Jay. Today I want to be discussing a topic called brain aneurysm. Now there are so many different types of aneurysm because it can happen anywhere along a major artery, which is one of the blood vessels in the body. But for this video purpose, I will only be focusing on brain aneurysm. So before moving any further, I own no copyright to any of the images or music that I'm going to be using in this video. So again, all my information that I'm providing to you is for information purpose only. It does not take away your doctor's advice or any medical professional advice. So if you or anybody else that may come in contact with my video to watch any of my content, if you have any medical issue or concern, do not delay. Please contact your healthcare provider. So for this video, I'm going to be discussing what is brain aneurysm, what causes brain aneurysm, what are the symptoms, or what will your body be going through that will signal to you that maybe you could possibly be having a brain aneurysm. What to do if someone or yourself is having a rupture brain aneurysm. What is the treatment for brain aneurysm? And then my last slide is just a list of references that I use to put the content together. So when we think about brain aneurysm, what is it? This is a very serious condition, and it can happen to anyone at any given age. But research shows that it is most common in people between the ages of 30 and 60 years old. And then it's also more common in women than in men. That means for brain aneurysm will usually occur between when you're around the age of 30 and 60 years old, and it's mostly found in women versus men. So another way that you will hear brain aneurysm being called is cerebral aneurysm. So what actually happens is an area um, along your artery becomes weak or thin. And then that area creates like a balloon that bulges out and fills with blood. If you can see on the diagram I have above, you see how this balloon is formed. So this along here, this is your artery. Okay. And then an aneurysm is this little bulge or balloon that have formed along the walls of your artery because this place became weak. So as the blood was flowing through your body, it was collecting in this little pocket here. And it continued to collect in the pocket until it bulges and forms this balloon-like structure. So you see up here too, this is what happened along the artery. Okay. So the collection of this blood in this balloon-like structure, it puts a lot of pressure on the nerves and on your brain tissue. If you look in the diagram below, this is the brain right here, and you see this is the aneurysm that is in the brain, and you see all these little thin thread looking lines that are here. These are like your nerves ending. So this brain aneurysm put pressure on those nerves and on the brain tissues. So this is a very serious condition. So if you're asking you like, hey, John Jay, this sounds like a really serious condition, but what will put me at a higher risk for getting brain aneurysm? Cigarette smoking is considered one of the leading causes of aneurysm. Now, this is the case regardless if you currently smoking or if you were smoking before and you decided to stop smoking, you are still at a higher risk of possibly developing a brain aneurysm. And this is because over time, the cigarette smoke destroys the walls of your arteries and it breaks down the lining inside of your arterial wall, and it also raises your blood pressure. Another reason that could put you at a higher risk of developing brain aneurysm is hypertension, which is high blood pressure. So Over time, if you have uncontrolled high blood pressure, or if your blood pressure is not managed properly, it damages and weakens the blood vessels. That will put you at a higher risk for possibly developing an aneurysm. If you are predisposed to it, let's say during your development in your mother's womb, some of your genes got, messed up, that and then you develop a condition that weakens the blood vessel, that will put you at a higher risk too for developing a brain aneurysm. If you had a trauma or injury to any of your blood vessel, if something, for instance, you have a crush injury to your chest, let's say you fell on your chest, or something heavy fell on your chest, if there's like a crush injury to your chest, that can cause damage to your blood vessel and increase your risk for developing brain aneurysm. And lastly, these are just some, it's not all inclusive, but for my slide purpose, the last reason that would increase your risk for possibly developing brain aneurysm is sexually transmitted infections, which are called STIs. And an example is syphilis. So if you have syphilis and it's left untreated, it targets the walls of your artery, and it can weaken it too. So any condition or situation that weakens the walls of your arteries or thins the arterial walls, you stand a high risk for developing a brain aneurysm, because you will have little seepage of blood, as it's weakening. Like I said in one of my videos, it's almost like a balloon. You blow air in it or you put water in it, it gets larger and larger and larger. The more water you put in it, the more it gets larger. So same way, if there's a weak area on the arterial wall, as the blood is traveling through your body, through those arteries, some of it will be seeping out gradually, seeping out gradually, seeping out, and just stretching that thin area and develop a balloon. So these are some of the causes of brain aneurysm. In most cases, when someone has brain aneurysm, or if you have a brain aneurysm, you may not even have any symptoms. Most people don't even experience any symptoms until the aneurysm becomes very large, or if it ruptures and bursts. So some symptoms that someone may be having if that aneurysm is large and continue to grow, because the larger it gets and as it continues to grow, it put pressure on the tissues and the nerves. And this pressure, it causes pain. You may have pain above and behind your eye. You may be having some numbness or weakness, or you may notice that one side of your face is paralyzed, or you may have some vision changes, like you will be seeing double vision. If you're looking at one thing, let's say you're looking at a cup, instead of seeing that one cup, you will see two cups. So those are just some of the symptoms that someone with a large and growing aneurysm may be having. Now, if that aneurysm happens to rupture or burst, this can happen all of a sudden, like it happens suddenly. So most people that get to this point will experience a sudden and extremely severe headache, and they describe it as the worst headache of your life. You may be having headache before, you have had headaches before in the past, but this headache is so extreme that you can't even compare it to any other headaches that you have experienced before in the past. It's like a thunder clap, or like a really bad headache. So it's not something that you can miss. All right. Some people may also develop nausea or vomiting. Nausea simply means you feel like you want to vomit, and then vomiting is when you actually vomit. You may also be experiencing double vision. You probably will feel like your neck is stiff. You will be sensitive to light. That means when somebody put light on, it will like kind of irritate your eyes, or maybe make this headache even worse. Some people may experience seizures. Sometimes you may lose consciousness, and then worst case, it may send you into cardiac arrest. Cardiac arrest is simply your heart stop beating. Okay. So this is very serious when the aneurysm ruptures. So it's important to pay attention to your body and know when something is wrong or when something is different, so you can be able to get medical help as soon as possible. When the aneurysm ruptures, let me see if I get this thing to work. You see up here in the diagram, when the aneurysm ruptures, this is how it looks in your brain. See, this is the artery, and this is how it bursts. You see how all the blood is like pretty much just pouring out. And if you look at the diagram below, this is the extreme headache that you experience when that aneurysm bursts in your brain. Okay, this can cause serious health problems. And some of the problems that it can cause is it can cause a bleeding stroke, where because the blood is just pouring out anyway, so that pouring out of blood throughout your brain can cause you to experience a stroke. It can cause brain damage, it can cause you to go into a coma, and it can even kill you instantly. So the bleeding in the space around the brain is called subarachnoid hemorrhage. So if someone is having a ruptured brain aneurysm, if it's you, or if you near somebody and they express to you that they just had the worst headache ever in their life, and you notice some of those symptoms that are listed in the previous slide, it's important that you get them to a hospital fast. Okay, because the quicker you can get into the hospital, it lowers the risk of permanent brain damage, because they can get quick, they can get tested quickly, and they can get the right diagnosis, and they can get the right treatment before they lose their life, or before they experience any of those serious complications or health problems that it can cause if it's rupture and there's a delay in seeking medical care. So if you're wondering if there are any treatment out there for brain aneurysm, first thing is not all brain aneurysm require treatment. So if it's a small aneurysm that's newly, developing, and it's slowly growing, usually those ones don't require any treatment. It just require monitoring. But if you have been told that you have an aneurysm, you and your doctor, it's important that you work with your doctor to determine the best treatment option for you. Okay. However, there are some steps that you can take to reduce your risk of having an aneurysm rupture. Okay, so again, the first thing is you want to carefully control your blood pressure. Blood pressure is very important. As I'm doing this research and bringing out these videos, beginning to realize that most of the medical complications and issues that we are having is linked to high blood pressure. High blood pressure being poorly managed. So carefully control your blood pressure. If you are a smoker, work on stopping smoking. All right. I know it's hard, trust me. Any habit that develops over time is very difficult to drop instantly. But you have to purpose, first of all, accept that you have this problem. And if you seek the necessary help, there are so many there are so many help out there to help you successfully stop smoking. But stop smoking is very dangerous to the body, to your overall health. So it's important that you work on stopping smoking. Avoid or limit cocaine use or any other stimulant drug. So pretty much, if you use illicit drugs, you want to try to work on stopping those. Now, so if you have a large, let's say you have a large aneurysm, that's not ruptured yet, or if it's already ruptured, some of the treatment that the doctors may do or intervention that your doctors may do for you includes surgery, and that surgery is considered highly effective, and it's called microvascular clipping. So what that simply means is, with the microvascular clipping, It's a surgical procedure. So a tiny metal that looks like a clothespin or a clip is placed on the aneurysm neck to stop the blood from going into that balloon of that balloon structure. So you see up here, this is what a microvascular clipping looks like. Looks like a clip or like a clothespin or whatever. It's clip looking. So they pretty much clip the bottom of the aneurysm to seal that place off. So when your blood is traveling along your arteries, it's not going back into that ruptured space or into that large balloon structure. So that's a microvascular clipping procedure. Okay. Um, you see down here too, this is like a rear artery. And this is how this balloon-like structure form, and this is the clip. Another treatment for brain aneurysm is called endovascular treatment. Okay, with endovascular treatments, it includes a platinum coil embolization. So a platinum coil embolization, platinum coil embolization is a technique where the doctor will insert a plastic tube from your groin into an artery to the aneurysm. So if you look at the diagram above, so this is where this, if you look down here, this in this human figure diagram, right here is your groin area. So this is where they will insert this tube, and this tube will go all the way up here along your artery, and it will send it directly to your brain, to that aneurysm. Okay. So another type of endovascular treatment is called flow diversion devices. So with this method, the doctor will place a small stent, which is also called a flexible mesh tube, in the artery to reduce the blood flow to the aneurysm. Okay, so if you look down here, the diagram below, this is the stent that they put in the artery, I mean, to prevent the blood from going up here into that balloon space. Okay. And then another type of treatment is pretty much to manage the symptoms and prevent damage. So this one can be achieved by taking medication to prevent you from getting seizure and also to control your blood pressure. So again, you're going to work with your doctor. If you have been told you have a brain aneurysm, you're going to work with your doctor, and you and your doctor would discuss and decide the best treatment option for you. Okay, so we have come to the end of this video. I hope this was helpful. Thank you so much for watching and staying tuned to the end. Uh, Please do share the information to your families, your friends, and loved ones. And if you have not yet subscribed, you can subscribe to my channel, so that way you can get alerts whenever I come up with new videos. Right? Until then, be blessed. Bye, and let us all work together to live as healthy as possible. Again, thank you so much for watching. Bye, and have a blessed rest of your day. Have a blessed night wherever you are around the world.